It's a couple of factors. I mean, it's very clear that technology overall has improved. Device technology for studies such as these studies that I was referring to, endovascular studies, have definitely changed things. But beyond that, it's probably most linked with expertise. So a concerted focus of individuals, of stroke care providers, to focus on stroke and acute therapy, I think has gone a long way. The time effect in terms of how shortening times to treatment will improve outcomes is a complex topic, because people that know what they're doing can do it faster. It's, this is the classic speed accuracy trade-off. So targeting time alone is not going to cut it. It's being trained, familiar with stroke systems of care, and developing that expertise to have a very smooth transition from one step of diagnosis through management phases. Probably the biggest issue, I think, around this meeting is the impact. How does it change? What are the implications in terms of stroke care? And this is going to be different depending on where you are. And it's not always about where you happen to live, because people drive places, they travel, and we don't control when stroke occurs, and that's where you happen to be at the moment. I think that's going to change in coming years. Obviously, you can't do endovascular therapy remotely, at least at present, but the triage process can be done remotely, and that's a very interesting development in terms of the technology. So teleneurology in general has expanded by leaps and bounds. I mean, it is really taken on and brought in different approaches to care, where we can actually use your phone, your cellular device, and there's not one product but many products like this, to actually through a secure connection where the patient identification is completely secure, HIPAA compliant. You can actually see patients that way, and although telestroke was in place for a number of years now, it doesn't require very specific and cumbersome technology anymore. And then the imaging can be acquired. You refer to a community hospital. Most community hospitals can get advanced imaging, whether it be a multimodal CT or even MRI. They're not using it for that purpose, but these MRI centers could be used for in such a scenario. The care systems have to change to really leverage this capacity. And the real question that arises now is, how do you know when your care is sufficient at the local hospital and need to be moved to another center? I'll be the conservative one in the crowd to say we don't have data for that yet. That yes, we have data, and as we speak, mounting data for endovascular therapy, but you really need to have studies that prove that one approach and triage approach is better than the next, and that's not what the recent trials really targeted. So I think there is still some work to be done in terms of the research of the practical ends. How do we deliver stroke care most effectively, whether you're in a large city or in a rural community?